Hey guys, this is a video for you non-therapists out there that may be suffering from runner's knee. That is pain on the outer part of the knee. Now it can be helpful if you release tension from the glutes, because doing so can also reduce the tension that comes down the lateral side of the leg through a structure called the iliotibial band, the ITB, you may have heard of that, and then that can reduce the symptoms that you're experiencing from the knee. So we're going to be releasing tension from the glutes in order to reduce symptoms from the knee. Now, this is how we do it. I'm going to turn around so you can easily see what I'm going to do. So to self-massage the glutes, you can use a couple of different things. You can use a ball or you can use a roller. I'm going to show you how to use both. So using the ball, you want to try and target the outer lateral part of the glutes, okay? So not right underneath, under the bum bones, the hard bits there, that's not going to work. Not right on the side, on the bone on the outside of your hip, that also won't work. It's that bit in between. So in between the back of your bum, around the back of the sacrum there, and your lateral hip, it's that fleshy tissue there, that soft area that we need to work on. And you know it's the right area because it's a softer area and the ball will sink in and find those tender spots. So take the ball, place that on the floor, then on the side we're looking to treat, cross the leg over, and it's then very important that you take the weight through your arms. If you don't, you'll be sitting down with too much pressure on the ball, and that can be quite painful and unnecessary. So taking the weight through the arms and my foot that's on the ground, I can then start to massage the ball around that posterior lateral part, and I'm moving around and I'm feeling for any tender spots. And when I find those tender spots, I can work on those just by rolling the ball up and down to reduce that sensitivity. If you find it hard to be up in this position, place both feet on the ground and simply work it from there. This can be a little bit easier for you. It doesn't stretch the glutes as much, but it can still be a very effective way of achieving the technique. So there we go. Make sure you take weight through your feet, foot or arms, and don't put too much pressure down on the ball because this will cause unnecessary pain, and it's not necessary to do that in order to get the results that we need. If you have a foam roller at home, you can also use that. It's a very simple procedure. As we did with the ball, it's got a larger surface area than the ball, so that means that when you do this exercise, it should be a little less painful, or you can put more pressure through, or a combination of both. So once again, cross the legs over there, and then a roll over the front of the roller, and make sure that it really starts to target that gluteal tissue, all right? Once again, if you're having trouble with your leg up in this position, then have both legs down and simply perform the technique like so. You won't get as much stretch through the glutes, but you'll still be able to get an effective self-massage treatment through that area. And we're doing this again to reduce tension from here, which then transmits down the lateral side of the leg through the ITB and can therefore reduce symptoms from the runner's knee condition. Next, let's have a look at a taping technique for this condition. All right, so if I was treating a patient, I would want to tape all the way up over the lateral hip, but that's difficult to do on yourself. So the next best thing, guys, is this. Take the tape from just below the knee to roughly halfway up the thigh, measure the tape, and then cut that piece of tape off. And as we always suggest, just round those edges, because those edges will catch on clothing and make the tape more likely to peel off. So round the edges that make the tape last longer. Have your leg in front of you, okay? Slightly across your body, so not out here, but across this way, so you've got a bit of stretch down here. And then place the tape just below the knee, on the outside of the knee, on that lateral side, and then add a little bit of stretch through the tape, less than 50%, so somewhere in the region of 30 to 40%, and then no stretch on the end. Okay, so there's a bit of stretch as we come through here, but only a bit. Remember, less than 50%, less than half. Next, the most tender area will probably benefit from having a second piece of tape carefully placed over that specific region. So we're going to measure the tape, cut that piece of tape off, use our decent scissors to round those edges off, nice and easy, quick to do, and then tear the backing paper from the middle, all right? And then you can stretch it and place it over the tender area. So stretch and stick. And we call this piece a decompression strip because we have stretched it, and in doing so, as the tape starts to pull back on itself, it creates this decompression through the skin, and that can help to relieve pain from that area. So just to recap, we reduced tension from the glutes, which can help to reduce tension down through the lateral leg, the ITB, and that can help to reduce symptoms from runner's knee. And then we did some very simple symptomatic taping. You saw how easy that was to do. It won't take you long, and this can help to reduce symptoms when you're walking or when you're running. General advice, you're going to have a look at your training plan, and you may need to reduce your training load temporarily just to allow some time for recovery. I'd also advise having a look at your running style because runner's knee can be associated with overstriding. So I hope these quick tips help to reduce your symptoms. That's it for now. I'll see you soon.